Hello and welcome to Celiac.com news. Subscribe to our channel to get the latest celiac disease and gluten-free diet news. And if you have any questions, be sure to join the Celiac.com forum online at Celiac.com. And now let's move on to the latest Celiac.com news. Study links Alopecia areata, celiac disease, and other gastrointestinal disorders. Alopecia areata is an autoimmune condition best known for causing patchy hair loss on the scalp and other areas of the body. Beyond its visible effects, researchers have suspected that alopecia areata may be connected to other immune-related health issues. A recent large-scale study set out to examine whether people with alopecia areata also face a higher risk of developing certain digestive system diseases that are linked to abnormal immune responses. The research team conducted a retrospective cohort study using the TriNetX Global Research Database, which collects health records from hospitals and clinics around the world. They looked at over 117,000 patients diagnosed with alopecia areata. These patients were matched with individuals of the same age, sex, and race who did not have alopecia areata. This matching ensured that the results would not be heavily influenced by demographic factors. The average age of participants was 33 years, and the majority were women. The researchers compared the rates of several immune-related digestive conditions in the two groups, paying special attention to microscopic colitis, a disease that causes chronic diarrhea and inflammation of the large intestine. The analysis revealed that people with alopecia areata were much more likely to also have microscopic colitis compared to those without the hair loss condition. In fact, the risk was nearly twice as high. This applied to both forms of microscopic colitis: lymphocytic colitis and collagenous colitis. Another notable finding was that people who had both alopecia areata and microscopic colitis tended to be diagnosed at a younger age than those who had microscopic colitis alone. The study did not stop at microscopic colitis. It showed that alopecia areata was also associated with a higher risk of several other digestive disorders, all of which have strong links to immune system function. Specifically, individuals with alopecia areata had a greater likelihood of having celiac disease, Crohn's disease, eosinophilic esophagitis, and ulcerative colitis. These conditions all involve the immune system mistakenly attacking parts of the digestive tract, causing inflammation, discomfort, and long-term complications if untreated. These findings highlight the important connection between alopecia areata and immune-driven digestive disorders. For doctors, this means that when a patient comes in with alopecia areata, it may be wise to ask about symptoms such as chronic diarrhea, abdominal pain, bloating, or difficulty swallowing. If such symptoms are present, a referral to a gastrointestinal specialist could lead to an earlier diagnosis and better management of these conditions. The study reinforces the idea that alopecia areata is not simply a skin or hair condition, but rather a signal of broader immune system dysfunction. Detecting and addressing related digestive conditions early could greatly improve quality of life and long-term health outcomes. For individuals who already have celiac disease, this research is especially meaningful. It shows that other autoimmune conditions, such as alopecia areata, may go hand in hand with celiac disease. People who live with celiac disease already know how critical it is to avoid gluten in order to manage their symptoms and prevent further intestinal damage. This study suggests that they should also be aware of possible overlapping conditions, like alopecia areata and microscopic colitis, which could complicate their health picture. Awareness of these links can empower patients to advocate for more complete evaluations when new symptoms appear. In practical terms, this means that if someone with celiac disease begins to experience unexplained hair loss or new digestive symptoms, they may want to discuss the possibility of alopecia areata and related conditions with their healthcare team. Being proactive could lead to earlier interventions and more effective treatment. The study demonstrates a strong association between alopecia areata and a group of autoimmune gastrointestinal disorders, including microscopic colitis and celiac disease. It emphasizes the need for greater awareness, both among patients and healthcare professionals, that alopecia areata is more than a cosmetic condition. For people with celiac disease, this research is a reminder of the complex ways the immune system can affect multiple parts of the body. Recognizing these connections can lead to better screening, earlier diagnoses, and improved overall care. To get the latest celiac disease news and information, be sure to subscribe to Celiac.com News. Thank you for tuning in, and see you next time.